Here we go. So I thought that it would be useful to talk about stress and anxiety, given all of the uncertainties and the worries and the changes that are going on in the world right now, and how that can impact people with, everybody, as a matter of fact, but especially people with autoimmune disorders, conditions like lupus, etc. So this is just a slide. This is just one of the most recent studies. So this is I think the only study I'm actually going to cite. But just quickly looking at anxiety, depression in lupus, and so it was a 2022 study. Age range between 34 and 57, and so higher lupus activity, SLE activity. More frequently, musculoskeletal and neuropsychiatric symptoms were found in people with anxiety and depression. It was more common in moderate to severe disease activity, and the probability of depression and anxiety was also significantly higher, again, in patients with moderate to severe disease activity. So next. Oops, sorry. So just to have a quick look, I'm sure you all know what the lupus symptoms are that you experience, but I just wanted to do a comparison of symptoms of lupus and how stress affects the body. And you'll see that there's quite a bit of overlap. So these are many of the symptoms of lupus that I'm sure that people experience, especially when they're having a flare-up. So fatigue, body aches, joint pain, fever, rashes, lesion swelling, shortness of breath, dry eyes, hair loss, chest pain, headaches, confusion, and memory loss. Now let's have a look at the next slide, where we look at how stress affects the body. So, and I'm sure that trouble sleeping may also be a symptom of when you're having a flare-up of lupus as well, although I'm not sure I found that in the list. But weakened immune system, of course, headaches, high blood pressure, raised heart rate, stomach issues, weight gain, reduced sex drive. The list actually goes on in terms of a lot of cognitive issues as well, in stress and how it affects the body, decision-making, memory issues. So there's a fair number of overlap between those two. And so what I want to do is sort of distinguish the difference between anxiety and worry, and that's what we're going to go into next, so that I can try to see if we can find ways of helping you look at what the difference is, and strategies that you can use to deal with worry. So the next slide. So I'm going to start with excessive worry. And you may have heard the term GAD, or generalized anxiety disorder. So generalized anxiety, generally speaking, is chronic excessive worry, difficulty controlling your worry, accompanied by a variety of physical and cognitive symptoms, some of which we have already listed, again, in terms of fatigue, hair loss, headaches, confusion, memory loss, shortness of breath, anxiety symptoms. Worry can lead to that. And 5% of the population will experience excessive worry to the point where they actually meet the criteria for a psychological disorder called a generalized anxiety disorder. But many people will experience times in their life where they're worrying excessively about various things, getting their taxes in, how are their symptoms, will their symptom flare up, calm down, et cetera, et cetera. Many things going on in the world right now, of course. And so anxiety is adaptive when it alerts us to a problem, but it can be exhausting when there is no danger. So for example, the smoke alarm goes off when people have generalized anxiety disorder. The smoke alarm is always going off. And we know that there are times when, whether it's a smoke alarm or a car alarm, nothing's actually happening, but there may be somebody that blew out a candle, or in this case, the toast was burning, but the house is not on fire. And so for generalized anxiety, when people are excessively worrying, you may often feel like the house is on fire. If you watch the news every day, you may feel like the world is on fire. And parts of it are right now, but are we burning down? And so with excessive worry, we may be having sleepless nights and flaring up our symptoms when we actually, the house isn't on fire and we do have some control. So next slide. I know that some of the rheumatologists that I have presented to at rounds may recognize this little guy. This is Dexter, And he was 8 weeks old when I got him. So I could have worried about how big is he going to get. And he was 16 pounds at 8 weeks. So a little bit of concern as to how big he was going to get. But anyway, so, when you have anything, you can worry about it or you can enjoy it. And so anyway, so we'll move on to the next slide. So now we're looking at the difference between worry and anxiety. So worry is basically a collection of thoughts that you have that tend to be future-oriented. They're generally related to negative events, future negative events. You're basically predicting negative outcomes in the future. And that is accompanied by anxiety. Anxiety itself is the emotion that results from worry. So if you sort of really want to define it, worry is really a prediction or a hypothesis about something negative that's going to happen. And anxiety is the emotional reaction to those thoughts. So let's go on to the next slide. So this is called the worry engine model. So you have a trigger. So whatever the trigger is, Dexter. So the trigger is the puppy. He is small, but he's going to be big. What if he gets too big that I can't do this? What if he gets too big that we can't feed him? What if he gets too big? And then you start worrying and generating worry about that. And of course, the worry then relates to feeling anxious, sleepless nights, anxiety, feeling exhausted, and then demoralized. So the worry engine can be the what if can trigger off multiple things. Another example that was just talked about earlier are different types of medications and what may be the result of those medications. What if I develop an eye condition from my hydroxychloroquine? What if I develop a reaction to the vaccine? And then you worry. And then you start to become anxious, and then you may flare up your symptoms. And then you become exhausted, and so the loop continues. So the worry itself is not helping you to move forward in any way. In fact, it may actually help flare up your symptoms. So next slide. So there's two basic types of worry. One is worry about actual problems that you have to make a decision about, that you can make a decision about. So whether to call a friend, whether to pay your bills, whether to learn a new task, whether to get a vaccine. So those are actual problems that are solvable. Then there is the second type 2 worries. Those are worry about future types of situations or potential problems. Will your spouse get into a motor vehicle accident? Will they become severely injured? You won't be able to manage. And so those are the uncertainties that you can't predict, and you can't actually, there is no solution to them. And so in this example, Dexter's having his first bath. And so which type of worry is that? Will this bath ever end? What's going on? It ended and he was fine. So on to the next slide. So what is the fuel that's driving your worry? And in many cases, it's tolerance for uncertainty. So people who worry a lot, who excessively worry, they tend to gravitate more towards high intolerance for uncertainty. And so we all have different levels of how much certainty we do and don't want. Some of us want everything to be predictable, and we try to create our life in that way. And every day, every moment, sometimes working on how to make life predictable. And we can become exhausted doing that as well. And in the end, we don't have control over everything, but we try to. Some people try to take control of everything that they possibly can. So a tendency to view the world through a negative lens also fuels worry and generating all negative outcomes. Again, it's not a range of outcomes, but it's looking at mostly negative outcomes. And it's the what if, because usually we don't go what if for the positive things or neutral things. Usually the what ifs lead to negative things or catastrophic thoughts. So people intolerant of uncertainty require only a little bit of uncertainty to produce an extreme reaction. So a vacation plan, it's like, oh my God, how am I going to be able to deal with that? We have to have everything planned right down to the last moment of our trip versus people who may throw on a backpack and they have no idea where they're staying the next day, but they're fine. So most of us are somewhere in the mid-range, not at one extreme or the other. And that obviously makes it a lot easier to deal with the uncertainties of life. Next slide. So the intolerance for uncertainty dilemma. So, again, intolerance for uncertainty doesn't equal uncertainty in the world. So anything can trigger uncertainty. So trying to eliminate every possible uncertainty is really exhausting. It's like filling a bucket with a hole because there's always going to be uncertainty, even when we think, let's say, here's a good example. I have a patient who decided that she was going to, she worked downtown. She was going to walk home every day because she thought that would be the safest and fastest, best way to get home from work. So she was walking down Burrard Street one day, heading towards the bridge, and there is a bike lane with the cement barriers between the bike lane and the sidewalk, so that the bikes are meant to be safe, and then the cars pass on the other side. So she did what one would have thought was the safest thing you could do. And what happened was on her way home, a car jumped over the cement barriers and hit her. She ended up in hospital at GF Strong for months in a body cast, and was doing what most people, well, I think everybody would have thought that that would be one of the safest ways you could get home. But so there is, you can do everything absolutely right, but there's still going to be uncertainty in just about everything you do. But we obviously have to build a tolerance for a lot of that. Next slide. So the answer to how big was Dexter going to get? That's how big. About 85 pounds, and he's doing fine. So we lived with the uncertainty and ended up with a great big guy. Okay, next slide. So what are some of the manifestations of intolerance for uncertainty? Often, if you find yourself avoiding things, procrastinating, finding imaginary obstacles to things that you need to do, wanting to do everything and not delegating, trying to sort of control things, not fully committing to things, whether it's a job, a project, or a relationship, kind of having one foot in, one foot out of any of those things because of the uncertainty, excessive information seeking, reassurance seeking from others. And this is, constantly asking and not feeling like you're fairly confident with your own decisions. And again, this is in a variety of things. So there may be obviously times where we need to consult with our experts, our specialists, but if it's constant and if it crosses many areas, then again, it's intolerance generally for uncertainty, which increases the worry, which increases the anxiety. So double checking things, second guessing your decisions, being overprotective of others by doing everything for them and not allowing them to do things, attempting to over-explain your decisions or reassuring yourself with exaggerated optimism. It's like, yeah, I made the right decision, and you keep on coming up with all of the reasons why that was the right decision. So those would be different ways that your intolerance for uncertainty would be manifested, or if you see that in someone else. Next slide. So the consequences of intolerance for uncertainty behaviors. The goal for most people in that is to eliminate or decrease their uncertainty, but instead, the behavior actually perpetuates their anxiety. So, the procrastination that we talked about, the not fully committing, the excessive information seeking, the reassurance seeking, double checking, all of those things actually decrease our confidence. They decrease our efficiency. It leads to perfectionism and being the control freak. I'm sure we all know people like that. It leads to interpersonal difficulties and conflict because it's very difficult to have smooth relationships with people when there is with all of the other behaviors I just described. They're often passive in relationships, and there's very little spontaneity in life. So these are generally what the consequences are of intolerance for uncertainty. So next slide. So worrying about problems. So problems can be a big worry trigger. right? We have a problem, and what do we do with it? So people who tend to worry a lot do not tend to engage in problem solving to deal with the problems. And it's not due to a lack of them having problem solving skills, but it is due to a lack of negative problem orientation. So they are not orienting themselves towards the situation. They, again, because it leads to anxiety. So they tend to be people who hate problems. They don't, other people don't, they feel like other people don't have problems. They feel like they're not good at solving problems. Their problems can't be solved. Their problems are bad or threatening. So this all leads to a lot of avoidance, which again is one of the manifestations of intolerance for uncertainty. Next slide. So some of the common beliefs, and most of my patients will agree to almost every one of these. The most common beliefs they have is that they feel that their worry helps to motivate them to get things done. It helps them to solve problems. They think it can prevent negative outcomes. It prepares them for the worst. And worry is a positive personality characteristic because some people feel that that shows that they are caring and that they're responsible. And so we'll talk in a few minutes about this, but it's usually the very opposite of those things. So next slide. So what do we do? How do we deal with worry beliefs? What can we do? So one of the things is the motivation. So asking, does the actual worry, does it improve performance? Does it improve concentration or your energy level? Do you know anyone successful who isn't a worrier? So the answer to those two questions, of course, it doesn't improve performance. It actually worsens your concentration and you become exhausted. Sure, we can think of people who are not worriers who are successful. So worrying doesn't actually increase our success rate at things. It actually decreases it generally. Problem solving, are worrying and problem solving the same? They're not. Right? So worrying is, again, generating negative outcomes, predictions of outcomes, and problem solving is taking action and doing something. So again, do you know a problem solver who isn't a worrier, who just sort of takes control, deals with the situation, and tries to solve the problem when it is a solvable problem? Preventing negative outcomes. So every worry and bad thing that will still happen. So even if you worry, it's still going to happen. And is it the worry or your behavior that prevents the bad outcome? So if you've taken action to avoid a bad outcome, it wasn't because you worried, it's because you actually tried to solve the problem. And also challenging the belief that you're preparing for the worst, that you'll be better off dealing with the worst scenario if you worry about it. So, asking, how did you feel when something actually bad did happen? Did the worry beforehand actually make it easier for you to deal with? Probably not. It probably didn't reduce your anxiety at all. It just kept it at a high level for a longer period of time. And in terms of positive personality characteristics, does worry interfere with relationships? Yes, it does. We know that. Would friends or family say that your worry is a good thing? Most of the time, if you've heard people say you worry too much, they probably think that you do. And so it might be helpful to listen to input from other people if that is what you're hearing, or if you're trying to convince somebody that you know that's a worrier to listen. Okay, next slide. So here's Dexter again. So just a quick one. He knows he's not supposed to be lying in a mud puddle, but I don't know if I've seen Dexter look worried too often. If anybody has a dog or any, most animals usually seem to get along with things without worrying too much about stuff, except when they're going to get their next treat. Okay, next slide. 2 ways to build tolerance for uncertainty. So one is trying to do some sort of tolerating uncertainty experiments. You can just do on your own. So behavioral experiments related to worry, like calling someone that you've been avoiding, doing something that you've been avoiding, and then looking at, once you've carried out that behavior, have a look at how did it go, review it, how accurate were you about how it was going to go. 95% of worry predictions are inaccurate. Is uncertainty okay? Because most of the time we're not very good at predicting outcomes like that if we have that high of a rate of predicting predicting the worry. And so if worry predictions are inaccurate, then they're less valuable in that situation. So, we can look at situations where, this is going to be the worst thing that's going to happen. I know it's going to come out terribly. And then looking at how many times were your predictions accurate versus inaccurate. And that might be one way to challenge how much worry are you placing on certain things and how helpful actually is it. So next slide. So the other way to build tolerance is taking advantage of naturally occurring opportunities. So one thing is, if you were more tolerant of uncertainty, what would you do in the situation? So just asking yourself, how would I be in the situation? So I've had people who have been in major motor vehicle accidents again, and they are afraid to cross the street or be in a vehicle again. And so it's like looking at, well, I was never certain in all of those other thousands or more times that I've been in a vehicle, and I was fine all of those times except for that one. So I tolerated the uncertainty until that accident. So what's the likelihood that I'm going to be in an accident again? Chances again are extremely low. And it may take time to build up that tolerance for uncertainty, but by taking steps like that, it can be helpful. And then keeping the question in mind and doing sort of an uncertain thing every now and then, just as an experiment. Again, order something different, call that friend, do things that you have been sort of avoiding or putting off, and just to see how they go every now and then, and test the waters basically. And then making deposits into the uncertainty bank so that you can draw from that account when you're faced with another one. So it's like, oh, that went well. It went, I was okay with that situation, and my predicted worries did not actually come true. And so I'm not as good at that as I thought. And taking a problem-solving route is more likely to be successful. Next slide. So some tips for healthy living, just generally speaking, and you may have heard this. I'm not sure. I didn't hear all of the talks. I heard the last two, but so that some of this may be a repeat. Maintaining routines. So having a daily sleep routine, personal hygiene, meals, those are all healthy things as well in terms of keeping stress level down in general. Remaining active, regular exercise, minimizing negative news feed, which is maybe next to impossible these days if you can't turn off the internet, the TV, or any other news feed that you're getting. Social contact, establishing and maintaining regular social supports. Alcohol and substance use should be maintained at a minimum, and I think for people on certain medications, not at all. But you obviously, your physicians will let you know that. Screen time and video game times, not helpful to do for long, lengthy periods. Learning to relax, trying to do things that are actually helping you to unwind, and being aware of the things that are winding you up. So that's really important to know. It's like, what does wind me up? Is it a certain friend who's always in a high stress mode? Is it certain programs I'm watching? Is it certain things I'm doing? And learning to avoid those things because they're not helping me relax, and then gravitating more towards some of the things that do help you unwind. And then, of course, the last thing, which is what we've been talking about, is solving problems, trying to identify the things we can solve and working through those. Okay, next slide. Two more slides and we're done, just so that you know. So working through worries. So again, remembering that worrying doesn't actually solve problems. It doesn't motivate you. It doesn't make you a better person. It doesn't prevent the bad things from happening, or prepare you for anything, actually. Recognizing problems early on is helpful. Normalizing problems and looking for opportunities, not the threats. Thinking through your worries. So often people will say, I try to just do some relaxation. As soon as I feel worried, I try to do some relaxation stuff. That's fine, but you still need to work through the worries. So you can sort of do some self-calming, self-regulating, you do something that helps you to be able to focus again, but then focus on working through the worry, not just leaving it there, because that is avoidance. And asking yourself, if I were more tolerant of uncertainty, what would I do in this situation? And then the last thing is being okay with a wait and see, because in many situations, really, that's the only option that we have. Next slide. And then again, challenging the worries. So my symptoms are going to skyrocket from this stress created by these uncertain times. It could, if you don't deal with your symptoms properly, if you aren't able to take steps to bring your worries down, they could increase your symptoms, and we know that. So we take steps then. Or I won't be able to afford groceries or go to social events because of the increased costs. You know, the tariff stuff that we're all hearing about. How can I travel safely with all of the chaos in the world? Are there solutions to that? Are there places I can go that are safer? Are there ways I can travel that are safer, rather than a blanket, I can't travel anywhere, which would be the catastrophic thought. I don't know what to talk to others about because everyone seems so angry these days. There are often ways of having, you know, again, what problem, how can I solve that problem, by picking topics that are relatively neutral and avoiding anything that may be a contentious topic. So again, challenging the worries that you may have in situations and finding some solutions. They might not always be perfect solutions, but you can work on those and modify them until you do find a solution that is helpful, that works for you. And the last slide. So wish I had some feedback here, but so this is Dexter and his little girlfriend, Ruthie. They met when he was 10 weeks old, and he was already bigger than her. She's 8 pounds and he's 85 pounds. And it worked. So the last slide is just a slide of self-help websites that you can find. So if you want to go to the next slide. And again, if there are any questions, or if you, I don't know if you want to wait till the Q&A, or if you want to ask me questions specifically, I'll leave that up to the administrator.